Recording. All right, we are live. Welcome everyone to the Friday, January 29th meeting of the Baltimore County Delegation. I'm Delegate Pat Young, Chair. It is, I think this is the third meeting we've had virtually, going pretty smooth so far. Just a reminder to everyone, mute yourselves. If you are in the delegation, we're going to ask that you have your cameras on so folks can see who's here. If you have to step away, feel free to turn the camera off and come back. That is all appropriate. Starting right off on our schedule, we have Senator Van Hollen presenting to the delegation. Good friend of Baltimore County, champion for Maryland, and before hearing from you, sir, you have the mic whenever you're ready.
Well, thank you, Mr. Chairman. It's great to be with you in the Baltimore County delegation. And I do see Madam Speaker Jones. It's always good to be with you and the entire team here. And Mandy Heinel is on with me, who's helped be my eyes and ears in Baltimore County. And I just want to start by thanking all of you for the work that you've been doing in Annapolis and in all our communities to help our fellow constituents weather this storm of the pandemic, both in terms of working to defeat the virus and also help those who are in a lot of economic pain because of the fallout. What I thought I'd do is just really briefly sketch some of the actions we've taken at the federal level, and then happy to try and answer any questions you've got. First, I was glad that in December, we were finally able to pass a bipartisan relief bill, $900 billion. It was late in coming and it has some gaps, but it doesn't provide important relief. Some of the key provisions that apply, statewide include a continuation of the Paycheck Protection Program, although much better targeted to small businesses most in need, including minority-owned businesses and minority lending institutions. It includes a continuation of the unemployment insurance through mid-March at $400 additional per week. And then it provides some other direct relief. While it doesn't provide direct county and state assistance, it does provide funds to a lot of key institutions in Baltimore County and throughout the state. So, for example, in Baltimore County, the public schools received $197 million from this bill. It also provides help to universities. So, for example, Towson University received $27 million. University of Maryland, Baltimore County received $15 million. The Community College of Baltimore County received $21 million, a Goucher College, $2.4 million, Stevenson University, $4 million. So all of the higher educational institutions, community colleges in 4 years in Baltimore County received assistance. Some portion of that assistance was earmarked for students who were struggling, but there were a lot of other flexible funds there as well. One other pot of money that I wanted to specifically mention was for rental assistance, because I think we're going to continue the federal eviction moratorium, although there are some holes in that, as you know. But regardless of when that ends, we're all worried about a tsunami of evictions from people who can't make their rent, maybe big balloon payments that we were due. So what passed in December included $25 billion nationally for a rental assistance fund. And Baltimore County government will receive, this estimate, I think they may have already received it. I know counties have been getting in the last couple of days about $7 million directly to the county for rental assistance. And the way that's structured is the payments would actually go to the landlords on behalf of the tenants, but there's flexibility in how the county can set it up. There's also a lot of other money that is flowing to the state, and I urge all of you to help us at the federal level really make sure that that money that's going to the state is being spent where it's most needed. So for example, we just announced at the federal level $400 million to the state of Maryland to help with vaccine distribution and also PPE, masks, purchasing, tracing, all of those things. That's $400 million. Now, the state apparently is still putting forward its application to the federal government to actually access those funds, but they are sitting there now as soon as the state puts forward its program for how it's going to best spend that. So I urge all of you to do that. Other funds also came for transportation purposes and from the federal government for aviation. So, please help us monitor where those monies are going. Just on the vaccine distribution, because I know we're all very frustrated with what's happening right now. There are, of course, two pieces. One is the national supply, and the other is the state and local distribution systems. In terms of national supply, the Biden administration announced recently that they were going to be upping the amounts that come to each state by 16%. So on a daily basis, those weekly basis, those doses will be increased by that amount. Now, there are supply constraints beyond that in the short term because the Pfizer and Moderna plants are working at capacity. They're working now to bring online, and I'm sure you've heard, Johnson & Johnson has a vaccine that's been in clinical trials. They're going to be submitting it to FDA for approval. If successful, that would bring on another 100 million doses. On top of that, the Biden-Harris administration just purchased another 200 million doses. So we have a supply going into the summer, but that's the total number of doses. That does not change the immediate supply constraints. And so that is the challenge with the overall supply. As I said, they're increasing it in the short term by 16%. But the next thing that needs to happen, we hope, is the Johnson & Johnson vaccine comes online. Now, in terms of distribution, different states have adopted different models. The congressional delegation had a phone call a few days ago with the acting Secretary of Health in Maryland, Dennis Schrader. We got a briefing from what they were doing. We expressed our concerns. We look forward to working with you so that we have open communication. The CDC ranks every state as to how successful they're being at actually distributing the vaccine that's available in that state. Maryland is about 45th out of the 50 states right now. So, fifth worst in terms of getting the vaccine into people's arms. And we have a system where some comes to county health departments, some goes to the hospital, some goes to pharmacies. Whatever system a state adopts is fine. Now at the federal level, we're going to try to address some of these bottlenecks by leapfrogging over them. And you probably heard that the Biden administration is going to do more direct vaccinations and more mass vaccination centers. But we look forward to working with you to sort out this pipeline, because I think all of us want to make sure people can get vaccinated just as quickly as possible. And I'll just end by saying that we are working on the next round of coronavirus emergency relief legislation. You probably saw that the vice president put forward a plan of about $1.9 trillion to fill in a lot of the gaps right now and to provide additional relief. So why don't I end there, and happy to try and answer any questions people will have. But thank you all again for being part of Team Maryland during this really difficult time.
Thank you for the update, Senator. And just personal note, thank you for your work with the CARES Act and the federal funds that have been coming to the states. From an appropriation standpoint, the reason that Maryland is not in a worse state than it is now budgetarily is because of the federal money that's been coming in. So thank you for that work. I'll open it up for questions. And the first one I see is from Delegate Cardin.
Thank you very much, Mr. Chairman. Thank you very much, Senator, for coming in and talking to us. Two quick questions. First one is, we are dealing with a lot of police reform legislation in Judiciary Committee. I'm just wondering if the federal delegation, or from a federal perspective, whether you guys are going to chime in at all and talk about things from a federal perspective, so that give us some guidance or some possible testimony in favor of some of the legislation. That's number one. Number two is back to the vaccine discussion that you were just having. Last night, we had a town hall on District 11, and there were a lot of issues about the private versus public vaccine capability to provide the inoculations. And when you talk about the amount of vaccines coming in from the federal government, does that preclude private organizations, hospitals, from going and getting them and doing their own programs? And is Maryland allowed to go out, or companies in Maryland allowed to go out and get their own vaccines from Moderna or Pfizer, et cetera?
So let me take that one first and then talk about police accountability and reform. So the way it's working now, at least as I understand it, is the federal supply is divided up by state. And so no, a state cannot right now go out on the market to try to purchase its own supply because everyone is supply constrained. I mean, everyone around the world right now is already sort of put contracts together for the purchase of the vaccine. And one of the concerns that incoming Biden-Harris administration had was that the U.S. government had not purchased enough vaccine to vaccinate the right share of the population over the coming months, which is why they just announced the additional purchase of 200 million doses. But bottom line is, to my knowledge, there's no way that the state can, unlike with PPE, when there was that sort of chaotic situation, that I don't think that's the case with vaccines. With respect to the issue of police accountability, we are really hoping and working to pass at the federal level the George Floyd Justice in Policing Act, really important bill that was introduced last year and passed by the House. We never got a vote last year in the Senate up or down on that. Now that the Democrats have a majority, although it's a very thin majority, as you know, the vice president cast the tie-breaking vote. We hope that, I'm sure the House will pass that, and I'm sure that we will make an effort to bring that up and pass it in the United States Senate. And that has a number of provisions for federal standards, transparency, accountability. We're also working to pass, and I've talked to the Biden administration about a bill that Congresswoman Karen Bass and I have introduced, which is really a complement, a supplement complement, works together with the George Floyd Justice Policing Act, which is to encourage local jurisdictions, counties, cities to restructure in many ways, the way they respond to emergency calls that don't require a use of force response. So many of the encounters that we see, escalate into tragic killing and death, begin with mental health situations, substance use disorder situations, housing situations. So we have introduced a bill, doesn't mandate that local jurisdictions change their system, but it would create a pool of federal money for states that develop alternative emergency responses, alternative 911 responses where there's no use of force necessary. So bottom line, we are working to move on these fronts. With respect to state legislation, as you just indicated, this is an issue of reform at the local level. And I want to salute Councilmember Julian Jones and members of the council for that effort in Baltimore County. And then at the state level, you're of course working on legislation, and I am monitoring it very carefully, at least the different proposals that were put together by the task force that the speaker put together and others, and happy to, share ideas with all of you as you deliberate on these issues.
Thank you very much.
Thank you.
Thank you. Delegate Hill.
Thank you, Mr. Chairman. Thank you, Senator, for all your work and for taking the time to do the round robin with all the delegations today. Appreciate that. You got, Congress has a lot, obviously, that you're taking on, and I'm grateful that you can walk and chew gum at the same time. As you're rolling out this necessary relief, are you all actively keeping an eye on what I consider the booby trap of the 2017 tax bill? I don't think most middle-class Americans understand that their tax breaks are set to expire. And so I'm just wondering if Congress is keeping an eye on that little surprise and either figuring out how to message to people in the middle of this pandemic that there's more coming, or looking at how we might abate some of the hurt that's going to come as we come out of this pandemic recession and look at people's incomes and things being affected again.
Sure. Well, first of all, Dr. Hill, thank you for all your work in the legislature and as with your healthcare hat on. Yes, we're looking at both the tax provisions and expiring provisions, but also very importantly in this proposal, the American Rescue proposal, there is a provision that would cut child poverty in half. And this has not gotten a lot of attention. It increases the child tax credit, makes it fully refundable to households. And it's a substantial relief measure. We also increase the earned income tax credit for right now we have a family earned income tax credit. This goes to single adults. That's on top of many of the other provisions. And so that should be actually providing additional direct relief. While that relief in this bill extends, through this year, it is actually something that we hope to make permanent, the fully refundable child tax credit and earned income tax credit. But bottom line is, yes, we are looking at all of these things. I think we're determined to pass relief quickly and in a way that, all of our constituents feel the benefit. It's really important that we take actions that, provide direct relief to people that they can feel in their pockets when they're stretched thin. So we're working on that as a delegation, and I do want to. I'm sure you'll be hearing from other members of our delegation as the season goes on. But Senator Cardin and I are working on these issues with a focus on Maryland, and of course, Congressman Rupersberger and Fume, Sarbanes. Everybody's working together on this as well.
Thank you. Delegate Bhandari, Delegate Bhandari, followed by Delegate Stein.
Thank you, Mr. Chair. Senator Van Hollen, first of all, I would like to thank you and your staff for your continued help with constituent services throughout the pandemic, from USPS issues to Social Security issues and more. And you and your staff have been a tremendous help. Thank you.
Thank you.
Availability is obviously a big issue, but so is making sure people actually take advantage. Given some of the mistrust around the vaccine, would you like to share something? What is Congress doing with regard to combating bad information or misinformation to ensure we reach herd immunity?
Well, first of all, thank you I know that our office has worked with yours on some of these mutual issues regarding constituent matters. And, we invite all of you to work with us on those issues. I will say that our biggest caseload continues to be people trying to process their unemployment insurance benefits at the state level. It's been frustrating. We have, hundreds and hundreds of cases that we're continuing to process, and look forward to continue to work with you to better streamline that system at the state level. In terms of I know that the Biden administration is part of what they're planning to do is much more of a public information campaign to allay people's concerns about the vaccines. I mean, these vaccines are safe. They are very effective, relative to other kinds of vaccines. I think they're looking for, trusted community partners to get that word out because it's most effective when somebody in any particular community who's trusted is the person urging people to get vaccinated. So that is definitely part of the strategy that the incoming administration's adopting, a much more robust public relations campaign.
Thank you.
Thank you.
Delegate Stein, followed by Vice Chair Brooks.
Thank you, Mr. Chairman. And Senator, thank you for everything you're doing for Marylanders during these very challenging times. We all appreciate it. And I also want to thank you in particular for your work on behalf of the environment and for protecting the Chesapeake Bay. I know that you've gone to bat to make sure that funding for the Chesapeake Bay program not just is not cut, but is actually increased. And I was thrilled to see the president sign a number of executive orders with respect to climate, making fighting climate change a top priority. And I wanted to ask, is there any legislation that you think the Senate will be considering this year with respect to climate and more broadly the environment?
So first, Delegate Stein, thank you for your own efforts in the area of environmental protection. And thanks for mentioning, one of the big success stories over the last 4 years was, despite the fact that the Trump administration in their budgets first zeroed out federal funding for the EPA Chesapeake Bay program, and then, proposed to cut it from $73 million a year to $7.3 million a year. Despite that, we were able to work on a bipartisan basis in Congress to increase it. Senator Cardin and I in the Senate, and the delegation in the House, and we're now at around $85 million a year. So, and actually a little higher, 87 million, and increased the authorization, and also opened up a new program authorized with the Fish and Wildlife Department for the Bay. So that is a success story. In terms of the incoming administration and legislation, as you pointed out, Dana, of course, the president, vice president just rolled out a number of executive orders making it clear that fighting climate change would be an all of government effort. The legislative piece of this will really come on the bill that's going to come after the coronavirus relief bill, the Build Back Better bill. And that will include a major additional investment in deploying, clean energy and, renewable energy, energy efficiency. We're proposing, more financing authorities, what we call a green bank. So there are lots of provisions in there. This is going to be hopefully it will be the second major piece of legislation that is adopted by the Congress. We'll have to see. In the Senate, we have a very, very narrow majority, and we earlier talked about the filibuster rule. There is another vehicle which everybody is learning more about now around the country called budget reconciliation, which is a device you can use in the Senate to pass things that are budget related by 51 votes. We're all trying to get, bipartisan support for both the president's emergency bill and these other measures. That's our strong preference, but the backup plan is to use the budget reconciliation process if necessary. to pass these things.
Thank you.
Thanks.
Vice Chair Brooks, followed by Delegate Jalisi.
Thank you, Mr. Chair. Good morning, Senator Van Hollen. Thanks for your presentation.
Good to be here.
Start off by dating myself. This was back in 1979, and that's when Congress started partially taxing unemployment insurance, and by 1987, it became fully taxable. With so many Americans receiving unemployment benefits now, who have either never or hadn't received it in a very, very long time, would you not think it would be expedient to perhaps exempt or either postpone it at least until post-pandemic?
So, Mr. Vice Chairman, I know you follow these tax issues very closely, given your expertise. I remember our first conversation was on a tax provision under Maryland law. So you're saying, I think that the emergency unemployment benefits, I could be mistaken. I don't think those are taxed. Am I wrong about that?
Oh, they're going to be exempt from taxes?
Well, I'll have to get back to you on that.
Okay, that'll be fine. I thought they were being taxed, but okay.
I may be wrong about that. Let me find out, and Mandy can help me get right back to you.
Okay, that'll be fine. My second question, something I'd asked before, I think it was last year, and that was the investment tax credit, on renewables, solar panels, geothermal,
Yes.
wind, and it was being phased out, and I think this year is down to 22%, and next year, 2022, it's going to be 0%. So, and I thought at one time you had said that you thought there was a possibility that could be reinstated. Do we have any updates on that?
Right. This has been a continuing battle. We had hoped to extend it beyond that, expiration date, and at least maintain it at its current level. This has gotten caught up in a debate over other tax extenders, and right now we unfortunately have continued opposition from Senator Grassley in the Senate on the Finance Committee, to be very specific. So we're going to continue to work on this. I would expect, Delegate Brooks, that this is a priority in that second bill I talked about that we were just talking about in terms of dealing with clean energy and climate change, because as you know, I mean, these provisions are helping create a lot of homegrown jobs, and they really are a win-win. It's a, clean energy really is about a lot more jobs in the United States, good paying jobs. And so I'm hoping to continue that measure as part of the next round.
Okay, super. And that's WIN and WIND, right? Win-win?
Yeah, there you go. Win-win.
Okay.
Right.
Okay. Thank you, Senator.
Delegate Jalisi.
Thank you. My question was first regarding the comment you made earlier, which was about the budget reconciliation, the mechanism to pass stuff. So since we don't have a budget in the federal government, can you still use it for things that you may want to pass in the Congress? And my second question is more Maryland specific. So I've seen in other states about the distribution of this COVID vaccine, whether it's Pfizer or Moderna. And in other states, they're using physicians who have been giving out flu vaccines in the past. In Maryland, the governor of Maryland is planning to use outside companies and not the primary care physicians, which raises a concern among physicians if the distribution is going to be proper. So do you have any comments on one way or the other? Thank you.
So thank you. So these are the kinds of questions on the vaccine distribution that we as a federal delegation are also trying to get our arms around, especially because, the federal government just provided the state of Maryland with, $400 million of additional funds. So we would like to work with all of you to make sure that our distribution system is better streamlined than it is at the moment. As to who is best at actually delivering the vaccine, different states have done different models. What I do know, at least hearing from the county health departments, is that their rate of delivering the vaccine they've been provided is higher than, for example, the rate of distribution through the private channels that are being established in the state of Maryland. But again, we're trying to get this information to be useful, also to get the contracts the state of Maryland has entered into with some of the private entities, because of course, when you deliver the vaccine through a health department, there's zero additional cost to the taxpayer. I don't know right now, what pharmacies and others are charging, or the companies are charging as they distribute the vaccine. So it would be helpful, when you have hearings and things like that in Annapolis, to help us get to the bottom of this, because a lot of the federal relief does go straight to the state. Now, we are working hard, I should say, on this next round, the American Rescue Plan, to use the distribution formula for state and local government that was in the House HEROES Act. That was the bill that they passed in the House on a number of occasions. It never passed the Senate, but their formula would distribute a lot more funds directly to Baltimore County as part of the relief effort. So very quickly, the reconciliation legislation. Reconciliation is a process within the Congress to put together a budget. It begins with what we call a budget resolution that lays out the top lines for the budget in different categories. We're actually hoping as early as next week, this coming week, in the Senate to pass a budget resolution. The House has to pass an identical one, and then that sets up a process by which we can develop legislation. And if it's under that process, it can pass with 51 votes. I'm getting the weeds here a little bit, but the weeds are really important, because when you use budget reconciliation in the Senate, you cannot include measures that the parliamentarian determines does not have a budget nexus. So for example, we cannot pass the George Floyd Justice and Policing Act under reconciliation. We can't pass the John R. Lewis Voting Rights Act under legislation. Those are not budget provisions. To pass those on a 51 vote margin, we would need to eliminate or amend the filibuster rule. And I've been in favor of eliminating the filibuster rule. I think it creates, the Senate is already anti-democratic by structure. And the filibuster rule just makes it more anti-democratic, small d. And so I'm in favor of getting rid of it, but we do not have 100% consensus in the Democratic caucus. And when you have a 50-50 split, you need 100% support in the caucus for a change. So that's a little bit, you're a little bit in the weeds, but the weeds are super important.
Thank you, Senator.
Thank you, Bill.
Thank you.
Appreciate you taking the time and addressing us today. We've got some other business to attend to. We appreciate you coming and give us an update, and the accessibility of your office and your staff, including Ms. Mandy Heinel, has been a joy to work with. So,
wow. Thank you. Thank you, Mr. Chairman. Thank all of you, and look forward to working with you in the weeks ahead. Take care.
Thank you. Next on the agenda, we have Dr. Gregory Branch, the Director of the Baltimore County Health and Human Services Department. Sir, thank you so much for joining us and for the work that you've been doing for Baltimore County. You are up.
Can everyone hear me?
Yes, sir.
All right, then. Good morning, good morning, good morning. And thank you for inviting me. I'm going to jump right into this for a presentation. Let me see if I can Get the slideshow going. All right then. Can everyone see the slideshow? Got a thumbs up, Chairman?
Yes, Dr.
Okay.
Branch.
All right then. So basically, I'm going to do a very quick COVID-19 overview, Health and Human Services role, our vaccine rollout, and what everyone needs to know. The COVID virus is a novel virus, which means it's a new virus. It's here. It is ever changing, and it is potentially deadly. Today is January 29th, 2021. I first briefed the Baltimore County leadership on the COVID-19 on January 21st, 2020. Our first confirmed case was on March 12th of 2020. And unfortunately, our first death was on March 18th, 2020. At this particular time, we've got 46,618 confirmed cases in Baltimore County as of January 28th. And we unfortunately have 1,098 confirmed deaths as of January 28th. So we are at this point now simultaneously running 6 massive operations. Our hotline, we've got almost 40,000 calls that we've been responding to since January 28th. We've been distributing our safety kits, which is the personal protective equipment and educational supplies to our high-risk residents. And we've already distributed over 200,000 safety kits. We're doing contact tracing, and only in the months of October and December, we've already done over 13,000 contacts tracing. Outbreak and investigations, we currently have 121 outbreak investigations in different institutions and organizations around the county. With COVID testing, we have now performed almost 80,000 COVID testings since January 15th, or as of January 15th. And then we're also running our COVID vaccine. So our vaccine rollout, when we received our first doses, 100 doses of vaccine on 12/23, we distributed those and they were in people's arms on 12/23. Baltimore County leads the state in the number of residents who are vaccinated, and by the Department of Health itself, we have already vaccinated over 20,000 people. COVID vaccine, it's approximately 95% protective against a severe or symptomatic COVID. It continues to be limited nationwide. We don't know how much vaccine we're going to receive from week to week, although I did get a memo from the state last night that they are going to guarantee Baltimore County at least 975 doses per week. We are planning this week to give 8,000 vaccinations to our residents. So what we're asking everyone to do is to join the provider registry or the public registry. The provider registry were for our healthcare workers. We launched that on January 4th. We've had over 5,000 registered, and that is the link to the provider registry. We're asking everyone to join our public registry. We launched that on January 15th. We have over 176,000 people who are registered, and over 36,000 are 75 and over. And you can see what that vaccine registry link is there. So we're working to make vaccines more accessible as the vaccine supplies increase. So we will be adding additional clinic locations on the east and west sides of the county. We will be launching campaigns targeting harder to reach audiences, including our homebound residents. And then we are exploring transportation options for different individuals who may have issues with transportation. So everybody needs to sign up today on the registry. The registry remains open. Seniors who need assistance registering should get their family and friends and neighbors to assist them. If they don't have that, they can call 311, or they can call our hotline at 410-887-3816. And we're going to hopefully be able to connect them with the Department of Aging. And the Department of Aging will actually walk them through and help them to be able to register. I want to be very, very clear. Placing your information in the registry does not immediately create a vaccination appointment. So we invite everyone to join the registry, and then you'll get an appointment when a vaccine is available and when we're serving your priority group. At this particular time, Baltimore County is currently serving the priority categories of 1A and 1B, and we really are trying to focus in predominantly on our 75 and older. A part of 1B also is the education, and so we have vaccinated folks from the school system, private and public. And this, I know you all have seen this pyramid right here. I just wanted to show it to you again, 1A and 1B, and we're focusing on those at this particular time. We have not focused and cannot focus on 1C at this time because we've got to get through 1B. I told you we had like 35,000 people who were over the age of 75. If I'm only getting about 5,000 doses to 8,000 doses a week, you know how long that would take us to be able to get through the 75 and older. However, I hope and pray that we'll be able to get more vaccine in the near future. Be rest assured that if we do get more vaccine, we are able to ramp up. I don't know if anybody has seen the Timonium Fairgrounds where we're working at this particular time. If you haven't, you are invited to come out to see the mass vaccine clinic that we have there. We can move up without any problem at all. And we are now still ready to move to other locations within the county. Okay, so yeah, I want everybody to know they have to be patient. This is a marathon. It's not a sprint. We're going to be doing this for quite some time. And then even though we have the vaccine, I want to remind everybody we still practice the 3 W's. Wash your hands, watch your distance, and wear your face covering. And remember to assume that everyone you are meeting up with is potentially spreading the virus, and that's even your close friends and family members. And then we can go for any questions.
Thank you, Dr. Branch. I want to remind the members, Dr. Branch has a 10 o'clock, so I didn't realize that we're taking questions for Senator Van Hollen. So please keep that in mind. I'm going to try and get through as many questions. Anything we don't, please submit in writing and we'll get an answer for you. The first I have in no particular order is Delegate Evers.
Thank you, Mr. Chair. Dr. Branch, thank you for your presentation. One of the things that concerns me is that in 1B, we see teachers, educators. And given the governor's somewhat surprise announcement that he would more or less insist that school systems across the states open up schools for teachers, I know a bunch of teachers who are scrambling to find a vaccine before they are exposed to literally hundreds of people that could be transmitting disease. I wonder what you and your department are doing to reach out to them to make sure they know the best possible route to find them. And are you coordinating with the school system at all to help them to publicize those as well?
Okay, so let me just repeat again that we do not have enough vaccine. I want to repeat that because I want to be very, very clear about that. Now, we are coordinating with the school systems in that for the Baltimore public school system and the private school systems, we've asked them to prioritize their staff based on how they would roll out bringing people back into school. And then what we've done is we've provided the school system with the link to share with those prioritized staff so that they can then get an appointment to be seen. And we've done that with both the public and the private school. But I want to be clear, as the health officer for Baltimore County, my focus is going to be on 75 years and older. That is what I'm going to be concentrating on. I am not trying to ignore the school system, but the ones who are 75 and older, those are the people who are dying. So we have a limited amount of vaccine, and as soon as we are able to get more vaccine, we will get into people's arms. I want you also to know that in Baltimore County, if you look at our numbers, and you got to look at our numbers on a Monday, we give away 100% of the vaccine that we received. We receive our vaccine on Tuesday. And if you look at our numbers on Wednesday or Thursday, right, it's going to show that we have excess vaccine. That's because we got it on Tuesday. But if you look at the vaccine numbers on Monday, it will show you that we've given away all that vaccine that we received on the previous Tuesday. So we're putting it into the arms of people as soon as we possibly can. But I would just say there is not enough vaccine to go around for everyone in those priority groups.
Thank you.
Delegate Schlega.
Thank you so much. Thank you, Doctor, for joining us. And it'd be great if we could get a copy of your PowerPoint. Who can we contact when we need to get someone a vaccine, for instance? And I'm sure all of you can reiterate similar stories, but a 76-year-old woman with high blood pressure and diabetes has signed up on 5 websites and gotten no reply. So, how can we help folks like that? Secondly, I have assisted living facility that contacted me and, they can't get a hold of anybody to get on a list. And so help us help our constituents. And I'll let you answer that, please.
Okay, so I will just say to you that we're asking people to sign up on the registry, especially the ones who are, obviously 76 and over. But I gave you the numbers. I've got 33,000 people who are over the age of 75 on my registry.
Do they get an answer when they sign up, or
they get an answer that they confirmed that they signed up?
Okay, if they are not literate, is that number that you gave us, 410-887-3816, can they call that? Because some of these seniors cannot access this. You're asking.
Right. So what they're supposed to do, what we've asked them to do, is call their neighbors, their friends, and family. If they don't have them, they should contact 311 who can assist them. And they can also contact our hotline number, and then we will connect them with the Department of Aging who can actually work them through also.
Okay.
There's a lot of people who need vaccine. I understand that. However, I will say to you, there is not enough vaccine to go around at this point. And so therefore, we can sign up, but having them, and they can set up a multiple list, having them call constantly to find out where the vaccine is not going to be helpful.
Thank you.
And just to clarify on that, Dr. Branch, the Baltimore County Health Department is not equipped with staff to answer, I'm guessing this, to answer 75,000 questions or all of this related to the vaccine. Everyone's focused on administering, not the customer service of once they fill out what the next step is.
Right, and so that is why we have asked the neighbors and families and friends to help, and that's why we've asked people to call 311, and we really want people to just get on the registry. And I understand and recognize that people will get on the registry and they want to get an appointment. I will give them an appointment as soon as I have vaccine. And I want the legislators to know in Baltimore County that if you come to our clinic at the fairgrounds, if any of you've been there, we are able to we're doing right now easily 500 to 600 people per hour with a 15-minute wait, not to include the 15-minute where you have to wait on the outside, but getting through that line no more than 15 to 20 minutes. I can ramp up and I can do very easily 800 to 1,000 people per hour. I don't have the vaccine. So I'm ready. And you know that I have done for the past 10 years, I have been doing the annual flu shots in all 7 councilmatic districts. And I've done that simultaneously. And the reason why I've been doing that is because we were practicing. We were rehearsing for a time like this. So we're ready. I just don't have the vaccine. And so I know that's frustrating a lot of folks, and I apologize for that, but I hope and pray that we can get more vaccine. And then we'll be able to put it in, once we get it in our hands, we can put it into people's arms.
Thank you, Dr. Branch. I think your operations and the numbers have spoken for themselves in terms of how well Baltimore County is doing compared to other jurisdictions. Delegate Gantt, another question.
Thank you, Mr. Chair. Thank you, Dr. Branch. I appreciate your passion for this and the fact that you are really trying to explain these things to us and to our constituents today in a way that I think people can understand. I do start on something positive. A few weeks ago, my office contacted you because there was not a place for people with disabilities to sign up on the register, and immediately, like within 24 hours, that was changed. So I want to thank your office for your responsivity on that issue. And I know that that's really helped a lot of people with disabilities. I'm going to move away from the administration of the vaccines to the registry of the vaccines for a second, because a lot of my constituents actually don't have internet access, which is an issue. I recognize, and those with disabilities, I mean, unfortunately, as lovely as it is to say, call your friends and family, sometimes people don't have that option. You know, they are calling 311, and I think just because you've been so great listening to us in the past, I'd like for you to hear right now that 311 is not working the way that it should for these people who cannot sign up online. So I wonder if there is conversation about a more streamlined, maybe a different number for people who just can't sign up on the registry, but don't have all those other questions about where am I on the waiting list. I think that might be really helpful to that population.
So I would say that they should call our hotline, and then we will provide assistance to that person.
Okay.
Delegate Belcastro.
You guys might have seen that I was on the phone. I was actually just calling the hotline to see if you could get through to a person that that could help with the website, that help fill out the registry for you. And really quickly, I was diverted to a person that was able to help me fill out the form, the registry on the website. So I say that only because I know that a lot of us have been getting emails about those with disabilities and those being able to access the website. I was successfully able to get through to someone on the hotline just now. So thank you for that.
Thank you.
Got it. Excellent. Sorry, threw me off. Delegate Long, did you have a question?
Thank you. My question was answered. Thank you.
Excellent. Delegate Hill.
Thank you. And I know you have to run. Two quick things. Number one, are you planning on doing mobile units, particularly for seniors, but other people who aren't going to be able to get out to those sites to get their vaccine? And number two, are you able to give us a little bit more information about where the outbreaks are? Types of congregate facilities, or what kinds of places? Are there certain businesses, or, you know?
Okay. So we will be working on trying to get out into the communities with some of our mass vaccines, and then we are working on a plan to get out to the homebound patients. What I want to make everyone understand, it's a little different because of the nature of the vaccine. The vaccine, once you draw it up, that's it. You've got to use it, and you've got to use it within a certain amount of time, and it has to remain at a certain temperature. So with that in mind, obviously trying to get to a homebound patient with one dose is a little challenging. We're going to work through that, and it's going to happen. So we're working through that whole process and stuff like that. For the outbreaks are predominantly at our nursing homes and at our schools. Some of the schools that are open, right? So when you have these different organizations that are still open, that's where the outbreaks are. The definition of an outbreak for different places and different locations are different, and that's based on CDC and the state. So we've got well over 100 places that we've got outbreaks. And so we work with each individual one of those, depending on what it is, and ensuring that they are utilizing all the mitigating processes to decrease the amount of transmission that they have there.
All right, thank you. I'll follow up with you offline. Thank you so much.
Delegate Ruth.
Thank you so much, Mr. Chair. And thank you, Dr. Branch, for being here and for all your work. I know that this is an overwhelming situation, and I have heard, that your site is doing amazingly well, and that Baltimore County is doing a good job of administering the vaccine. My question is there information posted somewhere about the physical accessibility for the sites for people with physical disabilities who need, have problems? Is that posted somewhere? And if not, can that be? And what should someone do if they, for example, can't use a drive-through site because of particular disabilities, they can't get a shot in the arm?
So the site that we have at this particular time is handicap accessible. We have now, and I'll just share all this, you guys will kind of get it hot off the press. We have now rented golf carts, and we have the police cadets driving people from the parking lot to the place itself, like if you were in Disney. And then we also have school employees who are working to, we've got about 25 to 30 wheelchairs, so that when you hit the door, if you need a wheelchair, there's a person standing there and that person stays with you and wheels you through the process. And then we also have an area specifically for the handicap and special needs, that they don't have to stand on the long line at all. And they come straight into that area, and we sit them right down and we take care of them. So we've got multiple things going on at this particular time to deal with those folks. Delegate Hill, I didn't answer one of your questions. On our website, you should be able to see the graph of where the particular cases are around the county. And if you don't see that, I guess contact me and I will send that to you.
Dr. Branch, that sounds great. I really appreciate all that. Just really quick follow-up. If somebody needs to, I don't want to be graphic, but they need to disrobe because they can't get the shot in the arm, is there a place for them to do that?
What we would do is we would actually bring a screen, and then we would cover them. But I will tell you that for the most part, you'll be very surprised. We have a few tricks up our sleeve that we can get to an area and give you that injection. Don't worry about that. We can get that, and we'll make sure that the person can remain modest.
Thank you.
Dr. Branch, you see it's after 10 o'clock. I appreciate all the time that you took with us today. I know you have another meeting, and just really quick, it doesn't need to be anything specific. Delegate Cardin wanted a clarification. Approximately 46,000 positive cases combined, not at one particular time, right? 46,000 since the beginning of the pandemic.
Yeah, cumulative, yes.
Cumulative, great. Okay. With that, if anyone else has further questions, please send them to Barb. We will get them to Dr. Branch and get you an answer. Thank you.
Well, God bless you guys all. Thank you so much. Remember public health when it comes to the budget. We're trying to, I got to say this, I'm gonna just take a few seconds, but we are building this plane while we're flying. And the infrastructure of being able to deal with a public health threat is not there, because over the past couple of decades, the budgets for the core funding for public health has been decreased. And so I would say that please remember us so that we can have the funding to have the plane at least already built before we start flying it. And I do want to remind everybody, those 6 major categories that we're doing now, I am still running a public health department. So we still got sexually transmitted diseases. We still got tuberculosis. We still got to go out to those restaurants, right? Everything that we normally do, I am still dealing with medical assistance and getting people on that, right? And when the president signs and says we're going to go back to where for Obamacare, that means that I got a lot more. I got thousands and thousands of people who are now going to be coming in trying to get insurance, and I still have people dying, and I'm dealing with the opioid epidemic. So when I say all this, please don't take it as if I'm whining, because this is what we do. We can do it, but as you know, we need the resources to be able to do it. And we have to stop waiting until the public health threat is beating down our door before someone says, well, let me give you a little bit of money for this. We have to stop doing that. We knew this from H1N1, we knew this from the Zika, and we knew this from Ebola, right? Every few years, there's a public health threat. And so I just say to you, remember that, and please, please, please ensure that they increase our funding so that we can actually build the infrastructure, and then we're ready to fly the plane, right? And we're not flying and building simultaneously. So thank you very much.
Message received. Thank you, Dr. Branch.
Right there. Bye-bye.
We will be moving into bill hearings. And the first one on the agenda is HB 181, Baltimore County Board of Elections, election of officers. Delegate Evers, you have the mic.
Thank you very much, Mr. Chair. House Bill 181 is a re-entry of HB 1633 from 2020. It's currently cross-filed with Senator Sidnor as Senate Bill 150. This is a bill that seeks to remedy a small problem that we recognized in the election of officers on the board. Currently, there are 12 members, and the election of officers would require 7 votes to elect them. That in itself is a task if you have a competitive race, because that represents nearly 60% of the vote, but it is, as it should be, more than half, one more vote than half, and that makes sense. However, if there is a member who is not currently serving, I'm not talking about being at the meeting, I'm saying serving, and this particularly, the example is a real one when the unfortunate death of Roger Hayden created a board of only 11 people. Still 7 votes are required, and in that case, the percentage goes up significantly and is more than half the members serving. So currently, the code reads, at the first meeting of the county board in December each year, the county board shall elect a chair and a vice chair from among the members. This simply inserts at the first meeting in December of each year, the county board shall, by a majority vote of the voting members currently serving, elect a chair and vice chair from the voting members. And that means that if someone had resigned or in the unfortunate situation died, we would have 11 voting members serving. And in that case, it would only require 6 votes, which would be much more reasonable if only 11 members could vote. This is a small adjustment, and it does not involve other voting procedures. It just involves picking a chair and a vice chair that is chosen by the majority. And on that note, I will conclude my testimony.
Questions for Delegate Ebersol? Delegate Hill.
Thank you, Delegate. We passed this bill out of delegation last year. Is that correct?
No, it was a fatality of our early dismissal last year. We didn't get around to it in that particular case. So we didn't actually have a vote on it last year.
Okay.
Other questions for the sponsor? Seeing none, thank you very much.
Thank you. I urge a favorable report.
Moving to HB 249, agriculture license to produce hemp limitations. Delegate Cardin.
Thank you, Mr. Chairman. Thank you, members of the committee. This is a bill that some of you who are on ENT are familiar with, and others from the central part of the county are familiar with. We've had an issue over the last couple years with a farm in Baltimore County that has produced hemp, and the hemp has generated noxious fumes that have impacted the quality of life and potentially the health of community members. And we're not just talking about a few. We're talking the aroma and the impact goes well beyond a square mile. I live about 2.5, 3 miles from the farm, and when the wind is blowing, it is very pungent right in my backyard. So last year we had a bill that was a very onerous bill on that had statewide implications to that actually Delegate Heddleman had introduced at the time. And ENT, instead of passing the legislation, wrote a letter to the county and to the farm, seeing if we could try and work it out. The farm in the process has indicated that it tried to reduce its period of what's the word I'm looking for? For collecting all the hemp in the late summer, early fall, and has tried to play around with different types of hemp to reduce the potency of the flowering plant. However, the community has indicated that it has not benefited the, thank you, harvesting. Thank you, Delegate Arakan. It reduced the harvesting period. The community has indicated that it has not helped in terms of their quality of life, and diminished quality of life, diminished property values, diminished capacity for children to play outside, and increased health concerns, particularly for elderly and for the young. So what we did is I actually put in a bill last year, which was also considered, which was much less egregious to all the members' opposition, and I think actually managed this much more narrowly and concisely. We decided to turn it into or request it to be a local piece of legislation. If you actually look at the bill does have statewide implications now, but the amendment that you should have gotten, and if you haven't, Barb and I will work together to make sure it gets to you, just makes it a Baltimore County bill. And for all intents and purposes, what the bill does is says is if you are a farm that is adjacent to at least 3 residences, and by the way, I'm not adverse to making it like 10 residences or even 20 residences, because I think that this farm is the one farm and only farm that it would implicate, that you can't grow hemp unless you are doing it inside or using some sort of mechanism to filter the air so that it doesn't harm the surrounding community. That's the idea behind the bill. I will say, just out of full disclosure, having spoken obviously with Delegate Stein and the committee, that they are not all that wild about the bill in ENT, even if it is a local bill. However, if it's not a local bill, it's certainly not going to be considered again this year. I think this is important for Baltimore County. I will say that Senator West, I believe, is very much has had to deal with this from constituents on the east side of the farm, and he's very much in favor of this. And I would ask our delegation to consider this as a quality of life issue. And I would also say that, and the final thing I'll say, Mr. Chair, I am very much in favor of agricultural preservation. I am not interested in closing down this farm. I am interested in trying to, when you have a farm that is surrounded by a suburban residential community, completely surrounded by a suburban residential community. This isn't like on the cusp of, and these people have been living here for decades. This is not like it's a new community that just developed, that just came around. I would ask that we try and figure out a way to get the community all to working together. And I think this is a way to do it that doesn't do offense or violence to our conscience. Thank you.
Questions for the sponsor, Delegate Impalaria. Delegate Polari.
Okay, thank you. Sorry about that. Delegate Cardin, so we're talking about the type of hemp that is grown like the colonials did for manufacturing purposes. This is not the type of hemp that is grown for smoking or for medical purposes. This is strictly a manufacturing type of hemp. Isn't that correct?
No, I don't believe that's correct. So the hemp farm was producing CBD hemp for, it wasn't for smoking, but it was for using for oils and for other medicinal purposes. And they have allegedly have investigated into a different strain of hemp used for agricultural purposes, as you're indicating, that would, in theory, be less offensive or less onerous on the community. And certainly that's something that we can consider, but I from my understanding is that they have considered doing it. There is, speaking with Kevin Addix, he indicated that they were in fact doing that. However, the impact on the community has not necessarily improved. So
Okay, and I guess my question, I just wanted, not that far, but just was clarification that this isn't hemp with a high THC level for the purpose of, there's two different types of hemp. Right. And this is not for that medical purpose.
This is not marijuana. It's not medical marijuana.
So, and I think.
Right, but there is, just so you know, so the CBD hemp, the hemp that's used, that by the way is not regulated, it's going to eventually be all closed down anyway because the FDA is coming after the whole hemp production for CBD purposes.
Okay, and one more question, because I don't want to drag, I know people have things to do. Is there anywhere else in the state of Maryland where we actually say you can't grow a certain plant because of the odor of it? Is that?
I don't think so, no.
Okay, that's all. Thank you, Delegate Cardin.
Delegate Gantt.
Thank you, Mr. Chair. I appreciate it. Delegate Cardin, I really appreciate you bringing this bill. I got a lot of those calls from your constituents over this issue as well. So I know you're doing a great job here trying to respond to the concerns of your constituents. However, in my district, 42B, which Senator West also represents, the right to farm is a very, very strong concept. And so there is a lot of opposition to trying to restrict farming access for any of those agricultural businesses. And I guess I would ask you, you talk about health concerns. I think a lot of what we've heard is anecdotal. And I like to make my decisions based on actual data if they're available. So I would like to ask you if there is actual data about health concerns, because certainly I would take that more seriously. And when you talk about adjacent to the farm, 3 houses, and I would say it would probably need to be more of a neighborhood than 3. What does adjacent mean? And is there data behind that distance? Like if you're 1,000 feet away, does that give you more harmful effects than if you're 1,001? So
I got it. Good question. So so in terms of the first question, we did have some community members that did some research on the health impacts, and if there's any information available, I will get it right to you. My office will get it right to you. I did not have it here for this meeting. I would have loved to have had something. Okay, that's number one. Number two, the way the bill is structured, it says that if the farm is 25 feet from a residence. Now, we can clarify, if we're going to pass this bill, I would ask the council that Mr. Joyce would help me with making sure that it's very, very clear as to what that means. Because I don't want there to be any question. Look, it could be, there's about, probably about 100 residences within well under 500 feet of this farm. So, so I don't think that we have an issue with, in terms of we can create a number that goes well beyond anything that's going to impact other farms in the region if we wanted to. But the idea is that the people who are, when I say adjacent, I mean the people that are within vision of the hemp. They can actually see the hemp like that. So let's say that there's maybe probably 20 houses that probably is within, that can see the hemp being grown through the fence. those people are the ones that certainly are the loudest. They feel as if the air is so thick their kids can't even go outside and play because it is just it causes nausea, it causes all kinds. People like my sister who lives about maybe, as the crow flies, maybe 750 feet away from the farm. She indicates that on certain days it's horrible, but to be perfectly frank, she lives with it, you know? So it obviously, if we had the bill from last year said that if you were within like a mile radius or a half-mile radius of residences, you couldn't, because that doesn't make any sense. That goes after basically every farm in the whole state. And that doesn't make any sense. So that was the reason why we did it the way we did it. And again, in terms of the actual language, if we decide we're passing this, let's make it as narrow as possible so that farms in the 42nd that are, and by the way, this doesn't in any way impact the right to farm law. I mean, you still can't file a nuisance claim against, this is a private nuisance claim again, which is what the right to farm is. This would be a legislation that would basically say, look, unless you're going to figure out a way to improve air quality, and you're in a neighborhood, you just can't do the hemp. And maybe we also do it. And by the way, there are ways of dealing with like the terpenes, which is the potency of it. And if it's below a certain terpene level, that it's okay. And if it's above a certain terpene level, it's not. I'm willing to compromise. I just want my neighborhood to not have to run away and leave for the entire August, September, and October because they can't live in that community.
Thanks, Delegate.
Thank you, Delegate Cardin.
Yep. Delegate Feldmore.
Thank you, Mr. Chair. Thank you, Delegate, for your explanation, and thank you for addressing the amendment. That was one of my questions because it appeared to be a statewide bill. I guess following up on the distance to residences, I guess the 25 feet that's in the bill, that says it's the distance to a property,
right?
The residence. So does that mean to the property line or to the residence itself?
That's a great question, and that would be up to interpretation. I guess we could ask council that. My goal, by the way, and I spoke with Kevin Addix from the Farm Bureau, from the Farming Association about this, and he asked the same question. My goal is to just have a clear, bright line. So if we say it's 25 feet from the farm to a residence, then we probably have, I can't imagine any other farm in the state would qualify, but this farm probably does. If we want to make sure this farm qualifies, we may have to say, what we mean is not property line, but the actual home abode. We may need to change it to like 40 feet, just to make it clear that because it doesn't make sense to pass a law that doesn't actually work.
Well, and then I guess that leads to my next question, which is, it says that the department shall evaluate the land subject to a license application as a whole without regard to the specific area where the applicant plans to produce hemp. And I'm not familiar with the details of the application process. Maybe you're more familiar. Is a farmer able to apply for a license for a portion of a parcel, or does the license apply to the entire parcel?
I don't know the answer. That's too technical. Maybe Delegate Stein does. Maybe if Kevin is on and going to testify, maybe he can answer it.
So actually, since you brought that up, Delegate Cardin, and since we have you here, it's a different format. Delegate Addix, Kevin Addix, I have you signed up in opposition. I was going to let you go ahead, and if anyone has further questions, they can direct it to either you or Delegate Cardin. So, Mr. Addix, are you on?
I'm here. Can you hear me?
Okay, I'm going to give you 2 minutes to testify, and then I'll open it back up to questions from the members.
Sure. I'll briefly state my opposition on behalf of the Maryland Hemp Coalition, and note that this bill, in its hearing, whether statewide or local, was opposed by the Hemp Coalition, which is a part of our firm, Grow and Fortify. but also the Maryland Farm Bureau, hemp farmers in Baltimore County. There are a number of them, as well as other agricultural groups, for a lot of the reasons that Delegate Cardin mentioned, that it is an affront to the right to farm, in that it would be the first time in Maryland law where by statute, the state is preferring one zone, one type of property, one use over another. I will commend Delegate Cardin for trying to solve a community issue, and now being a resident in this neighborhood and being potentially within the smell zone. I have to live through a summer and see which way the wind blows. I appreciate the concern, but it brings up a larger issue where we have this conflict between residential and agriculture. And this farm in question is one of the last most kind of southern in the central part of the county farms. All of these homes around it came after this farm. In fact, they were subdivided off this farm and off the farm's parent farm. And so the fact that this farmer is able to grow corn, cabbage, hog, over to hemp, that's provided under the fact that he is a farmer and there is a right to farm. Neighbors, when they move on into an area where it's an RC zone or an agricultural zone, it's in their settlement docs that they are, moving in near a farm, and they should be concerned, or at least be aware that there could be smells. Agriculture does smell, and that's something that farmers do take into account and do try to mitigate. As the delegate mentioned, this farmer did try to take on some different varieties, some different tactics, different procedures. He shortened his growing season so that in the stinkiest months, there were potentially 2 to 3 weeks less of that smell. And to answer some of the other questions, and I'm happy to be a resource on these, but hemp is part of the cannabis family. So it's a different strain than the medical marijuana. You've got hemp, which is low THC, and medical cannabis, which is tends to be the higher THC. So this is grown for everything. Hemp is grown for food in the form of seeds and salad leaves, fiber to make things, CBD oil to consume, or in salves to put on strains and sprains. So it's a very versatile crop. But we stand in opposition, understanding that there is an issue. There's a concern neighbor to neighbor here, but I'm not sure that this bill would solve it. There was a county text amendment that was withdrawn, which was attempting to solve it, but it ran into trouble. And there was a Senate bill last year that was voted unfavorable in EHE. So with that, be happy to take questions.
Thank you, Mr. Addicks. A question from Delegate Erickson.
Thank you, Mr. Chair. Yeah, he touched on a lot of the things. I was wondering sort of what used to be grown on that property, and I think, correct me if I'm wrong, you said cabbage? Is that what you said? Used to be grown there, Mr. Addicks?
So in the past, he has grown vegetables. The farm is primarily I guess the family business is primarily landscaping, and so they have trees and a nursery business. They've diversified. They used to grow cabbage. The neighbors didn't like the cabbage because it smelled, and they've grown many things over the years. But it's always been a working farm.
Yeah. And how old is it? 1800s? Are we looking at 1800s here?
If my recollection is correct, this family, the father bought this farm in the 60s, and I'll put an asterisk that I'll have to find out for sure. But before that, it had been a farm forever, and it was subdivided into two, and the other half that was subdivided off, then over time subdivided into many dozens of properties.
Yeah.
And as Delegate Cardin pointed out, this farm is unique. I've not seen many farms that are almost horseshoe surrounded by homes. It is the last of the farms that far south in this part of Baltimore County.
Yeah, it feels like a planning and zoning failure, right? You know, to do it like that. I'm really, really sad. Thank you for answering those questions.
Thank you.
Delegate Kramer. Sorry, Delegate Kramer, Delegate Kramer, I apologize. You can't hear, but the voice is not. Okay.
You are.
We'll follow up with you. Delegate Metzger. Delegate Metzger.
Yes, thank you so much. Delegate Cardin, have you been to this farm?
Yes, I have.
Have you toured it, visited inside?
No, I was on it only once. I did get to walk around. I didn't go into every single place, but I mean, I walked through the majority of it.
Did Mr. Vint give you, Pixini, did he give you a kind of a tour, or did you just kind of scout around?
He did not give me a full tour. It was more of a, you know, hi, how are you? And let's.
I need to tell you that I'm in opposition to this, and I'm against this entirely, because when I looked at this and took a tour of this, I was out there 3 or 4 different times. Now I got to tell you, I live near the disposal plant in the Dundalk and Essex area. So if you talk about a smell, that's a smell. So we're going to move the disposal plant? I don't think so. But I will tell you that when I toured this place and I looked in the buildings, and I just curiosity asked him what kind of tax base he was looking at or what we were looking at. And he said, in that pile right there, there's probably 25 million in tax base. Then we looked at something else and he said, that's probably another 25,000 million in tax bases. So when I look at this and then I talked to a couple of the residents, and a couple of the residents says, sir, I got to be honest, it's not been bad. It's not been bad at all. So I need to tell you that 3 times out there and visiting and seeing the tax base that this farmer has. And he did say, if they don't want this, I'll raise chickens and or any other kind of thing. So my thinking is, if you want to move the 25 feet, all he would have to do is move a row of crop 5 feet more or 10 feet more. So what I'm saying is I'm totally against this, and I will be voting in opposition.
Okay. Thank you all for the conversation. Mr. Addicks, thank you for your testimony. Moving on to HB 555, Baltimore County Alcoholic Beverages, Class D beer, wine, liquor licenses, Delegate Long. And just so everyone knows, if in the future folks have votes or things pulling them away and other committees hop off, I may have to do that, and some other members of appropriations. I'll be throwing it to Vice Chair Brooks. But Delegate Long, when you're ready, you have the mic.
Thank you. Thank you, Mr. Chair. I'm here today to present HB 555, Baltimore County Alcohol Beverage Class D beer, wine, and liquor license. What this bill does is update the out-of-date law that prohibits Baltimore County from issuing a current alcohol beverage license to a drugstore. One of our local businesses, Drug City in Dundalk, is having an issue with the current law, and the Drug City owner, George Fotis, will be here to explain why he needs this update.
Oh, sorry, Delegate Long, you're throwing it to your panel?
Yes.
Okay. Is that Mr. Fotis you said?
Yes, and you also have Jack Malone.
Yep, Jack Malone. Mr. Fotis, if you're here, go ahead.
Let me unmute.
There you go.
Good morning. So
You have 3 minutes, sir.
Sure. The drugstore prohibition that this line that we're talking about was something that we, or nobody I know of, was aware of when we first began the process of switching from an A, which is a purely packaged goods license, to D, which is a tavern license. And interestingly, nobody that I've spoken to then or since then actually knows why that specific line is on the books. or what the purpose of it actually was. And the other interesting thing is it's specific to a D license. We have 3 main licenses. The A is packaged good, B is restaurant and can be packaged goods as well. And then the D, which is tavern, and of course could be packaged goods. So this prohibition specifically saying that a drugstore cannot hold it is specific to the D, not the A or the B. And again, we're still not sure exactly why that's the case. So I got the D, but the workaround was to create a completely other entity, which essentially rents from the store. And it hasn't been a complete nightmare, but it's caused us a lot more work. Essentially, it's like we're running 2 businesses instead of 1. Now I got 2 tax returns. I have 2 insurances. Some vendors that we share, we have to split. 2 payrolls. It's logistically, it's a lot more work than we anticipated. And when I'd spoken to Jack Milani, he had actually said, this is something that we could possibly just strike through and remove it, especially since we don't know what the purpose of it or the intention of it even was to begin with. Again, I just believe there's no point at this point to this specific clause, and I'm hoping for all of your consideration in doing away with it.
Thank you. Mr. Milani, you have the mic.
Yes, Jack Milani, Baltimore County Licensed Beverage Association. Just before you guys think I've lost my mind, let me remind you that this still prohibits a chain from holding this license. The reason that we were so agreeable to Mr. Fotis is he's an independent business. He's not part of a chain. So we look at this totally different. In the general statute, there still is a prohibition against a chain store, which would cover the rest of the drugstores. So, you know, we have met with Mr. Fotis over time. We find that he runs a very good business, and we're happy to be able to help him out.
Okay. Questions for the panel and the sponsor, Delegate Impalaria.
For Mr. Fotis, your question was why would they have this? Well, it's obvious why they would have it is because drugstores used to have soda fountains at them, where young kids would come and sit down at the soda fountains, and they would have ice cream sodas and with their mothers, and they would have Coke. So naturally, you wouldn't want to have a drugstore selling beer at the same counter that kids were sitting there getting candy and ice cream from. So I would think that was the historical reason of why drugstores couldn't have. That makes total sense. You would agree with that, correct?
I would. I can see that.
Yes. So I don't understand why the liquor board just can't convert your license to the type of license that you have, rather than us create that you want. In other words, you bought a different type of license and you really want a lesser license. That's really what you're looking for, is a lesser license. Sell alcohol, correct? You don't want to have a tavern in your restaurant.
No, I do. And it's interesting enough, what we have done, and I actually hold a D now, and we're practicing, we're actually an active D licensee.
Right.
And what we've done, interestingly enough, is put a soda fountain in where we have lunch service, we have a full kitchen, and we have alcoholic options. We don't have beer, but we do things like boozy milkshakes. We have a whiskey selection. We have a very strong bourbon community here in the store, in the area, and we really do a great job of being a destination for not only families, but for these specific customers looking for these special pours and cocktails.
Okay, well, you can't have a liquor store within so many feet of a church. You know, it sounds like what you want to do is run a tavern. I don't understand, or I can't agree with that. I understand what you want. I can't agree with you wanting to run that tavern within your drugstore. They are 2 totally different things. in my opinion, I've dealt with these liquor issues for 18 years now, and it sounds to me like you should be happy running your tavern if that's what you want to do, even if it's next door. But in my opinion, it does not belong inside the drugstore for all the reasons I said before, because, you know, if we let you do this, then taverns are going to change. The other tavern owners are going to come in and say, I'm going to do this, or other businesses will want to buy tavern licenses, you know, a flower shop. They could buy a tavern license, a flower shop, and they sell their alcohol. And, you know, that's not the purpose of a tavern license, in my opinion. But so I probably won't be supporting it, even though Jack has worked things out with you, and I respect everything, Jack.
Sure, I hear you.
I have to look back at the long-term history of why this is. And I think the soda fountain is nice, and the booze doesn't belong at the soda fountain or in the drugstore. That's my comment. Thank you. I'm done. Mr. Chairman, did we lose him?
Oh, okay. This is Delegate, so I'll go ahead and step in front for him. Yeah. Okay. Did anyone else have any questions for Mr. Fotis? Okay. All right. Go ahead. Alan. Just unmute yourself and go ahead.
Who are you talking to?
Senator Sallings.
I'm sorry, Vice Chair. I apologize. I didn't know you were talking to me.
Yes.
I want to thank Mr. George Fellas for being here today. And I am supporting, because we will be helping him out doing this, and I'll tell you why. We see many other stores, multi-taxing in other stores, like, for instance, Walmart's, that have auto industries and other things in their place. And I think they have took advantage of that. This is not a company or a business trying to take advantage of anything. All they're trying to do is run their store. Drug City's been a store there as long as I can remember, when I was a little kid. And they have serviced their community and their drugstore, and now they just want to do a little more for the community. And they have been a community-based store for decades. And so I'm working with the comptroller as we speak to see if there's something already in law that we can help them out, first of all. So I'm going to do all that I can to work with the comptroller to see if there's something in place. But I will cross-file to support this business in my community, do all that we can to help him out and help out the community. If you ever have an opportunity, you need to go to his new little restaurant place that he has for families. It's a quite nice place. And at the same time, they service a lot of different services in the community. And they've been a great establishment in the Dunlock area. And I want to thank him for coming, and I want to thank him for his testimony. Thank you, Mr. Vice Chair, and have a great day.
All right, sure. Okay. Delegate Grammer.
Thank you, Mr. Vice Chair. So I just wanted to put it in context here. In southeastern Baltimore County, we have a lot of businesses that serve liquor in various capacities that really do a disservice to the community. I mean, we've had shootouts at some of these businesses. We have a lot of businesses that will serve people who are already drunk, violating the law. We have businesses that will condone drug distribution on or near the premises. The business we're talking about here is probably the cleanest business that serves alcohol in my entire district. They have community festivals, same time every year, that are loved by the surrounding neighborhoods. I mean, this is a top-notch business. This is something that I think not only our district needs, but we need more businesses like this around Baltimore County. I think when we talk about these kind of issues, we should be the focus and attention we should give is to the businesses where we see the crime. And if we have a technical issue like this for what really are one of the best players in the entire county, I think what we should do what we can to support them. Thank you so much.
Okay, sure. Anybody else have any questions? Okay. Go ahead, Delegate Etzker.
Yes. Yes, thank you so very kindly. George, good to see you. Ladies and gentlemen, I need to reiterate with the fact of what my colleagues said. This is truly a destination spot in southeastern Baltimore County. I will tell you that my wife hates shopping, but I will tell you that when I have to go pick up my medications, it's always a 2 or 3 hour spot because first of all, she goes into the little diner and then she loves the gift shop. She loves the entirety of the whole business. And George is so community minded that he lets people to use his upstairs for a meeting. So I support this legislation. And I will tell you that you really need to take a look at what he's got there. It's not just a bar. Believe me, it's not a bar. So thank you very much.
Okay, sure. Anybody else? Okay, Delegate Arakan, go right ahead.
Thank you so much, Mr. Chair. Would it be possible for you, to the owner, would it be possible for you to give us like a link to a virtual tour so we can see? Because I'm not imagining, I'm hearing that it's a totally different concept than what.
Yeah, well, I'm in the space right now. I can just give you a quick turnaround if you want to just kind of see what we got going on. Again, we went for an old school style. You know, we got a jukebox. Again, full kitchen. Just a great place. I like to call it a soda fountain or an ice cream parlor with some alcoholic options like you see in many other states.
Yeah. So it totally changes. I'm thinking in my head CVS plus a bar next to it. You know what I mean? But this is a totally different situation.
Yeah, ours is a throwback. Yeah, for sure.
Okay, well, very cool. Well, thanks for sharing that with us. That helps.
Okay, any other?
Delegate Ebersol.
Delegate Ebersol, go ahead.
Thank you, Mr. Chair. I'm just curious, we're changing the style of license here. Would this be a newly issued license by the county, or would the owner be required to find an existing one and have it converted to this format?
So I have the D license. We're actually acting. What I'm trying to do is allow the drugstore to own it.
You're in possession of a license right now.
As opposed to different ownership. So, you know, as a formality and essentially a workaround, we created a different business.
The question is, you're in possession of a Baltimore County liquor license,
yes,
right?
Yes.
Okay, thank you.
Yeah. So the license you have right now, you say it's a Class D license?
Yes.
Which is a tavern or a bar?
Yes.
So you want to be able to bring a drugstore into that establishment and operate as a tavern and a drugstore, you're saying?
Well, I own the drugstore and I own the tavern. So when we initially started this process, the drugstore was going to buy the tavern, the D license. But then in our due diligence, we realized that wasn't allowed because of this specific line. Mm-hmm. And again, a line that goes way back.
Go ahead.
And it was our thought that we would do it this way. And then when I found out of the possibility that we can at least present it to you all and see if it would be possible to strike through and get rid of that prohibition, it would make running my business a lot more efficient and streamlined. It's not absolutely necessary. You know, we could keep it on the books and you know, again, we'll just continue with 2 payrolls and 2 insurances and 2 sets of vendors. It's just a lot of duplication for me. And I think really this law only affects me, this prohibition.
So let me ask this question. Are both businesses housed in the same building?
Yes.
But is the store separate from the tavern, the bar?
Yes.
Right now. Okay. Because I think currently, you know, that there would be the first violation probably would come to mind would be Rule 5. You know, you have someone under age 21 working, you know, if you got that person working in the drugstore, you can't necessarily have that person working in the tavern, you know. And plus, I think there are some strict lines on the different type of classes. Class A, which would be like a carry out off sale premises as opposed to Class B, which is on sale, or Class C, which would be a club, either Class D. Those are all on sale, you know. So if you're going to, you would probably run afoul because you would have people underage in there who would be in a place where alcohol is being served if they're underage. So, but you know, here again, that would be up to the a hearing before the
Sure.
committee. Yeah, and for the subcommittee, and then of course we'll listen to the pros and the cons, but at the same time would have to go by what the existing law states on issues like this. Okay. Delegate Cardin, go ahead.
Thank you, Mr. Chairman. Just two quick questions, Mr. Fotis. First of all, why wouldn't you just have all your employees under one, even though they could work in both establishments? Can't you just have them paid under one and then not have to duplicate?
I don't know. Possibly. I didn't even think of, I just, I was just under the impression I have to make them completely separate entities.
And then the other question is really for, I don't know if it's for Jack or for maybe council, but would this have, I mean, you say that you're the only one that this could impact in the whole county, but could there be others that could take, if we change the law? I think this is kind of going to what, I cannot believe I'm saying this, but what Delegate Empleri was saying. Could there be others that could take advantage of this in the future that we don't foresee now? And therefore we may be opening up a can of worms, even though we're trying to solve some of these problems, which I have no problem doing. I have no problem supporting this. I'm just wondering if we're going to then set a precedent, as discussed in the previous bill. We got to be careful about setting precedents.
Delegate, if I may.
Yes, go ahead, Jack.
Remember, Dave Mister has me by about 15 years, and David's looked at this every which way. This and Mr. Joyce, maybe you would concur. He said it would still, because of the general statute, it would still stop a chain from taking this. So I think the only thing that this could open up would be an independent drugstore. And an independent drugstore could carry a B license right now, or an A license, as we have some around the county. So, we looked at this very cautiously, and I will defer to Mr. Mister, because like I said, when Dave Mister was not aware of this prohibition, it really had us doing some digging. Delegate Empleri is probably partially right, but as many of you know, they changed the, on the Class D, a minor can be in up to, I believe now, 11, and then with parental supervision, they can stay the rest of the night. So a lot of that has changed. I think, for us, for an independent operator, we would be more than happy to help him. Obviously, if this would open it up to a chain, we wouldn't be on this call today in support.
Right. Okay, any other questions? Okay, Delegate Hill.
Thank you, Mr. Chair. So, Jack, I guess, and I mean, this isn't exactly the same. It kind of reminds me of the issue back in Howard County that the Bun Penny had with having a liquor store and having a bakery, and they wanted, people underage to work at the bakery, but they wouldn't be allowed to sell the liquor when they were checking people out. So it's sort of this dual thing. My question is, this is one way to do it. Is there another way? Can there be language that allows for an exception to be made as opposed to making a general exception and changing the law completely? Can this be addressed by saying that the liquor board can consider certain circumstances, in which case they can opt to waive this, or is that not a way to serve this one without opening up the door?
Delegate Hill, I believe that would be this body's doing. I don't think the liquor board would have the authority to make that unless you gave them some type of enabling, legislation to do that. And I'll double back with Mr. Mister, and perhaps Mr. Joyce can help us. We looked at this. We even debated some language where instead of removing it, we would add the word chain in front of drugstore. But, Mr. Mister's of the opinion that because it exists in the general statewide law that there's a prohibition on a chain store, He thought it would be redundant, but I'll be totally honest with you, no offense to the attorneys, but you know, if there's a better way of doing what we want to do, I think we're all open for it. But this is an independent operation, which makes it totally different in our eyes.
Delegate Impalera, go ahead.
Yes, and Mr. Fotis, this, I know you run a good business, and this is not an attack on you and to the body. I just want you to understand, a liquor license is a privilege. It is not a right. That's number one. Liquor laws are very complicated, and we must be careful as we move forward. So the good news is you're up and operating. You don't need this change today, so we can take our time to try to figure this out. Now, I can tell you, when I was young, my grandmother would take us down during the summertime, like 10 o'clock at night, and go to the local drugstore to get ice cream. Well, you see that problem coming down at 10 o'clock at night. In your place, under liquor laws, I wouldn't be able to sit at that soda fountain. See, it's against the law to have children under a certain age sitting at a bar. And you have a tavern license, so they're not allowed to sit up there. And it creates confusion. So I don't have a problem with you having a different type of license. I don't have a problem with, since you've already bought and paid for this license, the liquor board coming back to us and saying, we want to allow Mr. Fotis to change his liquor license, convert it to a different type of license. I don't have a problem with that. My problem, like Delegate Brooks said, this is complicated and you're going to run afoul of the law. And if you're going to do this, then why couldn't a garage do it? And working on cars, and they have a bar there. And it's a, let's think this all over. You're a good man. You're a good business. The good news is you're up and operating, and us not passing this isn't going to close you down. So I really think we need to take a serious look at this, because we don't want to create a problem for you in the future, for the public in the future, and something we have to come back and correct because we went too fast with this. And I saw Kevin Addicks was on here, and he knows it took us years to do something for the wineries and years to do something for the breweries. So let's just be cautious with this. And this is not like we're anti-you or anti-business. And that's what I'm going to say. So thank you for coming forward, and hopefully we will be able to help you. This may not be the way. And I understand, Jack, his biggest concern, unfortunately, he's singly focused on keeping this away from the chains. And I 100% agree with him. But me and Delegate Brooks see the other problems that it can create for you going down the road, like getting a fine because the 9-year-old is sitting eating ice cream next to the guy drinking bourbon at 9 o'clock at night. You know, I hope you understand that. Thank you. That's all.
Okay, Delegate Evers.
Thank you, Mr. Chair. So I've heard two things. Looking at the bill, it just strikes the prohibition against drugstores. Jack, you said originally you thought that it would eliminate chains, and then you pivoted a little bit and said we'd be willing to put that in there. If we did, and I, it's a rare moment, Rick, but I agree with you. It took me 2 years to run a similar bill in my district to try to help a business there that was running a really legitimate thing about churches, and they were close to a church, and the church wanted them there. And it took us time to get it up and running because we had to be very careful how we structured that, so that, and this is the nature of the question, so that other businesses that were not intended in this situation would be free to do the same sort of thing, other drugstores. And so I think we need to tie that down pretty tight so the rest of us in our districts can look at what businesses might be freed up to do something like this and which ones wouldn't. So this is sort of a question, but Jack, I'd love to talk to you offline a little bit about some of those details, because I know that talking to your counsel is important also on these.
And I would lean on Mr. Joyce. He's certainly seen all these bills over the years.
Thank you. It was sort of a comment, sort of a question, if we could talk later a little bit.
Okay, is there anything, does anybody else have a question for the?
Delegate Arakan.
Delegate Arakan, go ahead.
Thank you, Mr. Chair. I just have a little bit of concern while we're talking about this, that when people keep saying we need to avoid letting other businesses do something similar, I didn't understand that it was the purpose of our role to help just one business specifically and not, and sort of at the expense of potentially other businesses in the future. That just doesn't feel like what our role is supposed to be. So I felt like I had to say that.
Okay, all right, thanks.
Delegate Brooks.
Yes, go ahead.
Delegate Brooks, in closing, I just want to clarify that operation is already open. It's operating on a Class D license, and he's met all the regulations for Baltimore County liquor license. He's had inspections come in. He's did a lot of work. He's worked hard on this. This is more of a removal of an obstacle that causes him to have to do certain things, have to run dual payrolls, dual insurances, and things like that. I'm sure you're very aware, Delegate Brooks, if you're an accountant, so you can understand why he has to do it this way. And we're just trying to make sure that he can continue operating, but just try to take that hurdle so he doesn't have to deal with filing 2 different taxes and all that. We're here about helping businesses, and that's what this is here. We're here to help him streamline his business and take and make sure we can continue. Anyway, I'm just curious, Delegate Brooks, you're an accountant, correct?
That is correct.
All right, can you see where it comes into play? He has to file 2 taxes, 2 insurances. He has to have double everything.
Well, I don't think you want me to take. You probably wouldn't want my position on this one. So,
all right.
So okay, yeah.
Fair enough.
Is there anything else for the good of the order? If not, we're at the 11 o'clock hour, and I guess it's time for us to go ahead and
move for
move off. So I get a motion for
motion for adjournment.
Second.
Okay, all righty. So move. So have a good day.